Hello, I'm Jed Herman, Vice President of State and Federal Policy Implementation at Results for America. I'm joined here today by Susan Jenkins, who is the Director of the Office of Performance and Evaluation in the Center for Policy and Evaluation at the Administration for Community Living within the Department of Health and Human Services. Susan and ACL, as they're known, have worked with Results for America since 2018 on our Invest in What Works federal standard of excellence. This is our annual assessment of the federal government's use of data, research, and evaluation to drive key budget, policy, and management decisions. I've asked Susan to join me here today because ACL has shown strong leadership in evidence-based policy over the last several years. For example, in 2020, the agency spent more than 1% of its budget on research and evaluation related activities. It has also developed a suite of resources on evidence-based grant making, and it has implemented key deliverables of the Foundations for Evidence-Based Policymaking Act. Thanks, Susan, for joining me here today. Really appreciate it. Your agency's done some excellent work on evidence and data in just a few short years. So before we dive in, can you talk to me a little about what is ACL's mission? Why are you doing all this work? And what is evidence and data helping you do to meet that critical mission?
Absolutely. Thank you so much for inviting me here. I've really enjoyed working with your organization and you personally on the federal standard, and it has helped us to really improve the quality of evidence that we have. But in terms of ACL, the Administration for Community Living, we're a subcomponent of the U.S. Department of Health and Human Services. ACL was created in 2012 on the principle that all people, regardless of age or disability, should be able to live independently and participate actively in their communities. ACL is made up of a number of centers: the Administration on Aging, the Administration on Disability, the National Institute for Disability, Independent Living, and Rehabilitation Research, and we also have a Center for Innovation and Partnerships. We're primarily a grant-making agency. And so that being said, it's important to ensure that we're using the funds that Congress appropriates to us each year effectively and efficiently. We want to ensure that we are efficient with our funds, that we're using them as much as possible to serve as many people and improve as many communities as possible. And data helps us to do all of that. It provides us evidence to be able to know what works for whom, in what circumstances, and in what ways. And in addition to conducting program evaluations, which help us to answer questions about how and why programs are working, we also conduct program performance measurement to really help us to monitor and report on progress of our programs towards their goals, and to help us to understand what's working, how it's working. And we do a number of evidence building activities in that area.
That's great, Susan. That's a really helpful context to understand how all these pieces of evidence building, evaluation, performance management are contributing to your agency's really important mission, which is really more vital now than ever before, I think. So, as I mentioned, you've made a lot of progress over the past couple of years. What are some of the things you're most proud of that ACL has done for enhancing evidence-based programs over the past couple of years?
One of the things that we're most proud of is the ability that we had to come together as an agency to work in collaboration on our learning agenda, or evidence building plan. Required under the Evidence Act of 2018, evidence building plans help agencies to identify priority questions that, if we answer them, will help us to do our work better, more effectively, more efficiently. And so being able to work across the agency to come up with a priority question, and we focused on one question related to how effectively we are implementing programs for formal and informal caregivers. It was really a good experience. This question covers all of our priority populations, as well as all of the different centers and programs that we have in ACL. Something else we're really proud of is our data governance structure. We stood up a data council in the previous year, and we really have been able to work together across the agency again to bring in a lot of different people with different experience in data, people that are comfortable, more comfortable, less comfortable with data, and to bring them in. And we got a lot of good feedback from those people about what the data council was able to do. So really the collaboration, working on evidence and bringing in all parts of the agency are what I'm most proud of in our work in this area.
That's great, Susan. I think that's a really good illustration of what the Evidence Act was intended to do. You just talked about how the evaluation capacity assessment you did, how you brought in people from across the agency to do that work collaboratively. I think that's really the spirit of the Evidence Act, right? Is how do you bring people together to help them improve the work the agency is doing and build the agency's capacity to do that work and then apply that to better results. So I think that's a great illustration of how agencies can do this work. Obviously, that's not always easy, right? Especially when you're engaging many different stakeholders from across the agency. So what's been the biggest challenge for you in this process of trying to build this culture of learning at ACL?
Mhm. The biggest challenge is a series of different resource challenges. And so one of the resources, particularly in 2020, that has been in short supply is time. Most of the staff that we work with, actually all of the staff that we work with, have other things that they do. They may be grant officers, they may be working on IT, they may be working on a range of different things. And so time to be able to include people substantively has been an issue. Another resource issue has also been having enough people actually to work on many of these things and having the time and training among these people to be able to work on evidence and to be able to help us to move forward with our evidence building has been something that we've been working on. And then also funds, having funds to be able to pay for evaluations and performance measurement through a series of contracts. So I'd say resources have really been the biggest challenge that we've been facing.
That's great, Susan. I think one of the things agencies like yours are finding through the Evidence Act and doing these capacity assessments is really identifying what some of the limitations are that they're facing and holding them back from doing more. And especially, obviously, in this era, time as a key resource. But I think one of the things that's really interesting that you highlighted is I think it's important that many of these staff have other tasks because they have policy tasks and programmatic tasks.
Mm-hmm.
You can add the evidence and data piece to what they're already doing. That creates something that's really powerful where they're mixing those pieces in their everyday work. So I think it's great the approach you've taken to try to train them. I know you've done a bunch of training sessions, some which you've videotaped that we've been highlighting in the Federal Standard of Excellence. So I think that's you've taken a very smart approach into how you engage people and make the most of their time.
And actually, on that same note, something else that we've done a lot of this year and we plan to continue doing is developing toolkits. And so we develop toolkits primarily for use by ACL staff, but they're written in such a way that our grantees can use them or other individuals can use them. They're posted on our website, so they're available to the public. But we have toolkits on developing logic models, on performance measurement, on strategic planning, and on data quality. And we have heard, even though they've only been posted for a short time, that staff in ACL, as well as other staff in the federal government, have been accessing those toolkits and have found them to be helpful. Because we are really helpful and happy in my office to offer individualized help and support. But by having the toolkits that are available when people want them, when they need them, we really can reach a lot more people that way.
That's great. And I think those are some really key tools to keep people engaged in this evidence building activity. Are there other ways that you're making sure staff at ACL or the public or other stakeholders or your grantees are being engaged in this evidence building work that you're conducting?
Yeah, thank you for asking. Something else that we did recently and we're getting a lot more sort of interest in is we worked with one of our program areas for health promotion and disease prevention. And they get semi-annual reports from their grantees talking about how many people they've served, what they've done, those various different things. And the semi-annual reports many times are very text heavy. And so to be able to use the data, the numbers, the quantitative information in those reports, we were asked if we could put together a pretty simple access database. And when the grant officers get their reports, they enter the relevant numbers in this access database and the cells change color if the grantees are exceeding their goals, meeting their goals, or if they're not meeting their goals. And if they look like they may not meet those goals by the end of the grant period. And so we've had a couple of other programs in ACL ask if we could develop a similar tool for them. And what's really good about it is it's easy. It makes everybody a little bit more of a data expert. but it's very visual. So people can see quickly if their grantees are meeting the goals and the targets that they've set. So that's another thing that we're doing.
That sounds like a fantastic approach. One of the things about working with staff or data and evidence is their everyday responsibility is they bring different capabilities and understanding of that. So providing them with tools can really make it easy, as you said, make them experts almost on how to do this. Seems like a very smart approach to doing that. There's been a lot of exciting efforts you've talked about, but I'm sure you've got some other things up your sleeve that you're working on. So what are the next steps in your efforts at ACL to continue building this culture of data and evidence use?
Well, one of our next steps, and you knew I was probably going to bring this up, we've had a Friends of Data competition. And so Friends of Data is something that we ask people, are you a friend of data? You can nominate yourself or someone else can nominate you as a friend of data. And to be a friend of data, you just have to respect data. You have to be curious about data and willing to use data and willing to examine your programs using data to help to improve them, to see what's working well and strengthen that, or what might not be working well and to address that. And so with this competition, when people were nominated, we would give them a button, a big 3-inch diameter button that said, I'm an ACL friend of data. And we would also take a picture of them and post a blurb about what made them a friend of data. And so it not only invited more people into being friends of data and interested in data and evidence, but also it showed other people in the agency that you don't have to be a statistician, you don't have to know the intricacies of research design to be a friend of data. Just asking data-related questions, ensuring that the data that you're getting are valid and reliable, asking for help, using the data in presentations, various things like that can make you a friend of data. So in this upcoming year, we are going to have a passport to data contest. And so we have these luggage tags, and we're going to have people fill out a form, a very brief form. Basically, have you done A, B, C, or D, a range of different evidence-related activities? And if so, then you'll get your passport to data. And we find that these kinds of fun types of things and having a little thing that we give away, a button or a luggage tag, bring people into the fun of data, what I think of at least as something that's really interesting. And that's been really helpful. Another area that we're working on is developing tools that can help grantees and grant officers to use evidence in their award making. One of our lowest areas of scores for this year's federal standard were in the area of using evidence for competitive and non-competitive grant making. And so we're working on some different tools, a roadmap, a guidebook, something like that with different job aids, checklists, and things like that, that people can use in looking at the data they have, determining its quality, and then rolling that back into future grant awards. So those are a couple of things that we're working on for the future.
Well, that's great. You're really speaking my language with the friend of data stuff and the passport to data. As an organization at Results for America, we certainly love that sort of thing and those engagement tools. That's excellent to see you adopting that approach. And of course, anytime you talk about using evidence in grant making, our ears perk up. So you're really hitting the nail on the head today. I appreciate you sharing those things. Speaking of that, we've really enjoyed partnering with you over the past few years and lifting up the work that you've been doing and learning about that and being able to share it with other agencies through our federal standard of excellence and with other stakeholders. Talk a little bit about how you've been using outside partners, whether it's Results for America or other organizations that have been helping you on this ACL evidence journey.
We work a lot and try to communicate as much as possible and increasingly communicate with our program staff, grant officers in particular, as well as grantees, and providing the data back to folks. And that helps them to then work with us to be able to provide better quality data. When people understand what we're doing with the information they give us, they're more likely to provide high quality information and realize that what they put into it can also help us in terms of what we can get out of it. And so that's been something that's been really helpful, and we will continue to partner on that. Developing the various tools that I mentioned, the toolkits and the using evidence for grant making tools, things like that. We'll continue to work with partners that way. And I will say that ACL's leadership has been very supportive in implementing the learning agenda, in working on our evaluation policy, in supporting us in building evidence and doing those kinds of things. And I do want to give a shout out to Results for America, because I think that being included in the standard, which was an honor for us in the first place, has pushed us to move much more quickly than we otherwise would have done. We see the value in evidence building and the learning agendas in the Evidence Act and high quality data, but having you all put forward publicly our scores on the standard have allowed me and our agency to move forward internally to say, this is really important. The public can see this, and so we can move a little bit faster. So I absolutely want to thank you for that. And also thank you for bringing together the members of the standard periodically to have various different meetings where we can share with each other our strengths and our weaknesses and get ideas from each other. Those have been really helpful to us in our evidence journey.
Well, thanks, Susan. Those meetings certainly have been informative to us as well, and what you say about the standard being able to sort of help you lift up your game at ACL certainly resonates with me. I was a former official at CNCS, and so I certainly, when we were being scored in that, thought that was a powerful tool for us to think about how we're elevating evidence and data in our work. So it's great to hear the way you're using that as well, and really engaging with folks in your agency around that. That's fantastic stuff. Just a final question for you here in a brief sort of 30 seconds. Give us an example or talk to us, how has evidence helped ACL improve outcomes?
Mm-hmm. We have been able to increase a number of different things in terms of some of our outcomes where we've topped out on those outcomes. We've decided to start looking into new outcomes that we can work on to show other elements of our programs. And so that's one way that we're using this process and these outcomes. Other things that we've been able to do are with our evaluation findings, we sort of plow those back into the programs. And so, for example, with our evaluation of our National Family Caregiver Support Program, we found that there were issues with using assessments, that not as many programs as we may have wanted to were using the assessments for assessing caregiver need. And so we were then able to talk to our grantees and provide some guidance and some materials so that they could improve their use of assessments for figuring out what caregivers need, how much they need, which caregivers that they could serve. So that was really helpful. And we've then also been putting forward challenge competitions through challenge.gov and developing some demonstration programs. And so, for example, a demonstration program that we currently have related to the Paralysis Resource Center, we had a question internally about what's the best way to fund quality of life grants. Is it at the state level or is it at the national level through the National Paralysis Resource Center? So we developed a demonstration program where we're doing both at the same time, and we're about a year and a half into a 2-year project. And then we will turn that around, and we're thinking about how we're going to plow that back into the next funding opportunity announcement so that we can make the best out of those two different approaches to funding those types of grants. And so those are a few things that we've done with the outcomes of our research.
Well, that's fantastic, Susan. That's a lot. We've had just a brief time here today, but you've shared a lot of really useful and important things with us, both about what you're doing at ACL and how I think other agencies could apply a lot of those things to the work that they're doing. So really want to thank you for taking the time to talk with us today about the great work you're doing at ACL. We look forward to continuing to be able to highlight that and lift it up through our federal standard of excellence and through videos like this. So thanks for joining us, Susan.
Thank you. You've been a great partner to us. I really appreciate the opportunity.
Thank you. Have a great day.
You too.